PROSHIELD skincare range is formulated for the prevention and management of incontinence-associated dermatitis, IAD, on both intact and injured skin. The PROSHIELD skincare range cleanses and protects, helping to restore the barrier properties of the skin, helping to maintain skin integrity. The PROSHIELD skincare range consists of PROSHIELD foam and spray incontinence cleanser and PROSHIELD Plus skin protectant. The products are free from parabens, petrolatum, latex, mineral oil, lanolin, and alcohol. PROSHIELD foam and spray is a gentle, pH-balanced, no-rinse moisturizing cleanser designed to minimize the irritation of intact or injured skin in patients with incontinence. Select which mode you wish to use, either the foam or spray. Use the foam mode for difficult to cleanse areas and where you need it to stay in place whilst cleansing. The foam mode is particularly useful for breaking down dried feces and debris while helping to eliminate odour. For general skin cleansing, use the spray mode. To use the foam mode, turn the nozzle to the on position. Pull out the tip of the nozzle to allow it to foam. Shake before use, then pull the lever in firmly. To use the spray mode, turn the nozzle to the on position and pull the lever firmly. Before using, prime the sprayer by squeezing the pump once or twice before initial use. Position the individual on their side and expose the area that needs cleansing, trying to keep them covered as much as possible for warmth and dignity. If there is a lot of liquid stool, try to isolate this with either the soiled brief or pad before cleansing. Make sure to remove all stool from the skin. If the affected area is severely damaged or quite wet, then gently wipe clean the excess moisture with a soft cloth or pad. Start by wearing gloves and selecting the correct mode. Start by cleansing the area with PROSHIELD foam and spray incontinence cleanser. Spray PROSHIELD foam and spray cleanser directly onto the affected area. For any stubborn, hard to remove debris, use the foam mode and spray directly onto the patient. And leave on the area for 30 seconds to allow the cleanser to break down any hard to remove debris from the patient. Gently wipe clean and pat dry the area. And change gloves before applying PROSHIELD Plus skin protectant to avoid any contamination. The no-rinse formulation eliminates the need for a basin of water, rinsing and moisturizing. Cleansing and reapplication of the PROSHIELD system should be repeated as often as necessary and in line with your local protocols and guidelines. Do use PROSHIELD foam and spray cleanser instead of soap and water for no-rinse, pH-balanced cleansing. Do use PROSHIELD foam and spray cleanser to cleanse both intact and injured skin. Do use PROSHIELD foam and spray cleanser to help break down dried stool. Do use PROSHIELD foam and spray cleanser to remove PROSHIELD Plus skin protectant. Do use PROSHIELD foam and spray cleanser to help eliminate odour. Do use PROSHIELD foam and spray cleanser to help moisturize the skin. Do use the foam mode for difficult to cleanse areas as formulated to help stay in place while cleansing. Do not rinse off PROSHIELD foam and spray cleanser or rub the skin. Just dab dry and reapply the protective barrier. Do not use the same bottle on multiple patients. PROSHIELD foam and spray is single patient use. PROSHIELD Plus skin protectant is a smooth, viscous and fragrance-free moisture barrier protectant, which helps protect skin from incontinence-associated dermatitis and moisturizes and conditions the skin. Start by wearing a fresh pair of gloves. On application, the product may appear tacky to feel, but smooth in appearance. The tacky formulation can help it adhere to moist and dry skin. If using on intact skin for prevention and protection, then a thin layer is enough. A little goes a long way. Begin by gently smoothing PROSHIELD Plus skin protectant over the affected area. However, do not rub in as this may cause friction. When applying on injured skin, select the appropriate amount of PROSHIELD plus Protectant to apply depending on the condition of the skin, in case a more generous amount is required. Gently smooth over the affected area, remembering not to rub against the skin. When applying over moisture on conditions such as severe incontinence-associated dermatitis, IAD, or moisture lesions, start from the intact skin and glide PROSHIELD plus Protectant over the injured area to ensure all areas at risk of contamination are protected. The consistency of the product will change, but PROSHIELD Plus is still effective. PROSHIELD plus Protectant is transparent for monitoring, but will leave a visible sheen on the surface of the skin and can be reapplied if no longer visible. Reapplication of PROSHIELD plus Protectant should be repeated as often as necessary and in line with your local MASD protocol and guidelines. Dressings are not required as PROSHIELD plus Protectant leaves a protective layer on the skin. PROSHIELD plus Protectant can still be used when wearing incontinence garments or pads and doesn't clog pads when used sparingly. To remove PROSHIELD plus Skin Protectant, simply spray PROSHIELD Foam and Spray Cleanser directly onto the affected area, then gently wipe clean and pat dry the area with no rinsing required. Use PROSHIELD plus Protectant as a skin protectant and moisture barrier. Apply a thin layer or a liberal layer of PROSHIELD plus Protectant, depending on the condition of the skin. Apply incontinence pads directly over PROSHIELD plus Protectant. Reapply PROSHIELD plus Protectant following each incontinence episode and in line with local moisture-associated skin damage guidelines and protocol. Reapply PROSHIELD plus Protectant if no sheen is visible on the surface of the skin. Use PROSHIELD plus Protectant on dry skin and to help protect peri-wound skin. Do not use PROSHIELD plus Protectant on deep injuries. Do not use dressings over PROSHIELD plus Protectant. The injured area is already protected from urine and feces, whilst enabling visibility of the skin. Do not use adhesive products over PROSHIELD plus Protectant, as the adhesive will not stick.